Hello, welcome to the Active Life presentation of Take Control, Reduce Your Risk for Falls. So in this presentation, you're going to learn about the main risk factors that contribute to falls for older people and how you can take control over many of them to reduce your own risk for falls. So this first quote, life is more risk management rather than exclusion of risks. It really speaks to the heart of what we're going to get at today. As we move through this presentation, you're going to see that there's many risks that contribute to falls, such as being a certain age or gender, or having a certain need to take a certain medication, or having a disease process. And these are things you can't necessarily avoid. But the good news is that there's many things you can do to manage those risks. So that's what we're going to focus on today, things you can control. So there are some pretty sobering statistics about falling. More than 1 in 4, or greater than 25% of people over age 65 fall. And those in the 85 plus category fall 4 times more often than the 65 to 70-year-olds. And 1 in 5 of those falls results in serious injury, resulting in more than 3 million older people needing to be treated in the emergency room every year due to those falls. So let's look at what puts somebody at risk for falling. Now, as we go through these, remember, risk factors are not the same as causes. Risk factors are items that are correlated with falls, but not necessarily what makes someone fall. For example, being older than 65 and female doesn't make somebody fall, but those who are in that group tend to fall more frequently. So as we go through this list, I want you to consider your own situation and really identify risks that you may have. As we go through the rest of this presentation, we're going to address each one of these factors and what you can immediately do to take control of each risk factor. So, for history of previous falls, that's not one that you can control. But if you have fallen once, know that you are at a higher risk for falling again, and making change should take on more urgency for you. Number 2, the fear of falling. This is a risk that we can control. So we'll get to that in a second. We're going to go through each one of these and be able to talk about what things you can do. So let's start with the first thing. After accounting for age and gender, and then the history of previous falls, which are all factors that are 100% out of your current control, fear of falling is the number 1 risk factor. Now, what's interesting is the fear of falling is really a two-sided coin. The first side is that the fear is based in reality. It's an accurate assessment of your own balance. If you're afraid of falling, people are pretty good at interpreting their own status. And so being cautious and aware of that can either help you by making you more aware, more cautious, but it can also hurt you. And that's what the other side of the coin is. That increased fear of falling oftentimes results in people quitting doing activities that challenge their balance because they're afraid of falling. So when your balance isn't challenged, it continues to weaken or decline, resulting in decreased stability in addition to what you already had, which increases your risk for falling again. And this becomes just a downward spiral of reduced activity, decreased stability, and then you quit doing as much and being strong on your feet, which then increases your fear, which then makes you do less. So there are things you can do to stop this. So let's look at what you can do to manage your fear of falling. So if you ever fear that you may fall, the best thing to do is address the underlying causes that make you fearful. So as we go through this presentation, I really want you to select the area or areas that affect you the most and consider implementing changes that can have an immediate impact on your safety. So the first one is mobility impairment or a low activity level. So after fear, this is the biggest risk. This really speaks to the old use it or lose it. The more you do, the more you can do, but the less you do, the less you can do. So if you can do something, then do it. It is important to keep moving, doing as much of what you can. So now I do know that there are injuries and disease processes that can definitely decrease someone's mobility, but even within most of those, doing something to get and to keep your body moving is extremely helpful. Two specific things: very small impact can have big, or small efforts can have big impact when you focus on strength training of your legs. That is number one. It can have huge impact on your balance. And then number two is focused on maintaining flexibility, especially in your ankles, as that is the groundwork for support. Let's move on now, and let's talk about something that it isn't always associated with falling, but it's vision and hearing. These are called sensory impairments. And one option to consider with your vision is consider 2 pair of glasses. So researchers have found that people who replace their bifocals with 2 pair of glasses, one for reading and one for seeing at a distance, reduce their risk of falls by 30%. That's a huge improvement. So many people will hear this, though. The first thing they say is, oh, I can barely keep track of 1 pair. I can't take care of 2. Well, I want you to reconsider that. When you reread the statistic, there are 30% decreased risk of falling. So might want to consider the options for keeping 1 pair on your head and 1 on your face, 1 around your neck and 1 on your eyes. Keep 1 in a pocket. Really consider the disadvantages versus the advantages, keeping track of 2 or not falling. So that can make a big impact, and it seems like it might be worth the hassle. The other thing is get your eyes checked. Make sure your prescription is up to date. Use sunglasses when it's bright out, and that could be snow or sun. And also there's self-tinting sunglasses. So if you're thinking, well, that's a 3rd pair of sunglasses, you can get self-tinted distance glasses that can reduce that back to just the 2 pair that I'm recommending. The other thing is make sure your glasses are clean. Part of your morning routine, just make sure your glasses are washed off, or do it a couple times a day as needed. So the next thing I want to talk about is hearing. So super interesting. Even a mild degree of hearing loss tripled people's risk for falling. So researchers speculate there could be a few different reasons why that is. Number one, you might not be able to hear hazards like a cat or somebody in your way or traffic, and so it's too late. By the time you hear it, it startles you. That might be part of the problem. Also, the ears help with spatial awareness, so knowing where the body is in relation to other objects around it. And then also those with hearing loss use more of their mental resources to hear. So you're paying attention to that. And since mental resources are not a bottomless well, that means those with hearing loss have fewer resources left over to dedicate to maintaining balance and negotiating obstacles. So what to do? Get your ears checked. Make sure you keep them clean. Use your hearing aids and turn them up if you need to. But also there's a couple things you can do in addition to that is decrease your background noise. So turn off the TV. Don't talk and walk at the same time. Use your vision more. Scope out your environment, for traffic and things like that before you start moving. So next, let's talk about cognitive impairment. Now, you wouldn't necessarily think that getting up and walking around is an intellectually challenging task, but it really is. It takes a lot of mental effort to do what is very, very habitual to those without cognitive impairment. So if you find that either your mind isn't keeping up like it used to, or if you have a loved one who might have some cognitive impairment, you can help them or yourself stay safe by following these recommendations. So first off, as the brain doesn't process information from the environment as quickly as it used to, it's really helpful just to slow down. Allow the brain to take the time, process, and then move. Really giving yourself more time to get from one place to the next, because hurrying can really cause the fall. Another consequence of cognitive impairment is the brain doesn't always process what the eyes see. So just because you can see it, if you're helping somebody else who has cognitive impairment, you might think it's obvious that there's something in their way. They might not see it. Or they might see it, but they might not process it as a hazard or step over it. So it's up to us to kind of keep the path clear. Remove clothing or towels from the floor, get the cat out of the way, whatever. Just make sure it's really safe for that person. And also, the brain might not be able to focus as well, and therefore it's really susceptible to distractions. So, again, don't walk and talk to the person at the same time. Let them focus on what they're doing. Turn off the background noise like TVs and radios, as that might pull their attention away from what they should be focused on, which is getting from point A to point B. Next, another thing that happens in the brain, which is depression or depressive symptoms. It doesn't need to be full-on depression, but even having apathy and decreased activity level and motivation can be associated with falls. And it's kind of a chicken and egg question. The researchers haven't really been able to figure out, is it the depressive symptoms that cause the falls, or do falls then cause people to be more depressed about their status? But it doesn't really matter because the solution is the same. So let's talk about some of the reasons it happens, and then let's talk about the solutions. Number one, decreased activity level. As people have depressive symptoms, they just don't feel like getting up and moving around as much. As we talked about earlier, that lack of activity can cause weakness and then contribute to falls. And even just fatigue, lack of motivation, lack of energy. And then apathy. If you're not keeping your house clean because you're depressed, which is it's a real thing, you might have more hazards, more risk factors in the way because you just don't care to pick it up at this time. So treating depression really reduces the risk of falls. So researchers have found it doesn't matter what causes it, but treating it helps. Now, the best news about all of this is that research shows that both exercise and eating a highly nutritious diet, meaning rich in fruits and vegetables, lean meats, complex carbs, and really low in processed foods, including sugars and things, that has been shown to be extremely impactful in treating depression. Exercise and eating well helps the brain, but the bonus is it also makes you stronger. So it helps the brain and the body. So that's really great news about the treatment or the recommendations on that one. It's a double benefit. All right, now let's talk about bladder control. And many people do not really associate the risk of falling with bladder control problems, but they do go hand in hand. Now, if you have bladder control issues or even feel an urgency to go, when you got to go, and that causes you to hurry, then there's multiple things you can do to reduce that risk, to manage this risk. So first, go to the bathroom on a regular basis so you don't end up needing to make a mad dash for the bathroom. So if you're going regularly, it'll decrease that urgency. And then if needed, it's better to wear a pad and even leak a little than it is to rush while you're trying to get to the bathroom and then fall. There's not a soft place in the bathroom, in anyone's bathroom. So the risk of injury is extremely high when racing to go to the bathroom. So next, if you get up at night to use the bathroom, make sure you use a night light or a motion detector light. So older eyes take a little bit longer to adjust. So hopefully you have enough time to get there. But if you are hurrying, make sure that it's a clear path in advance so that you can get to the commode, or excuse me, to the bathroom, or use a bedside urinal or commode so you don't have to go all the way there. And then, while it is super important to keep hydrated throughout the day, it's best to decrease fluids late in the day, especially alcohol. Alcohol, not only is it a fluid, but it also releases a chemical in your brain that makes you go to the bathroom more frequently. And so that combination is really hard on people who have bladder control issues. So the best news about this one is that bladder control exercises have also been proven to be very successful for people who do them on a regular basis. So really talk to your wellness staff or your therapist about how to get going on bladder specific exercises, because they can really help reduce that problem alone. Next, let's talk about medications. Medications are a big deal because most seniors are on at least one medication and many are on multiple medications, and that's what's referred to as polypharmacy. So the side effects of individual medications can cause decreased balance or increased risk for falls, decreased reaction times, etc. And also the combination of taking multiple medications at once can also have the same effect. And this is true either for prescribed drugs or for over-the-counter drugs or non-prescribed drugs, including alcohol. And as you add more and more, that just increases the risk of falls. So the solution for this one, now everyone is unique in their medical needs. So the best recommendation we have is really take some time with your primary care provider. If you fear falling or feel that you have a risk of falling, talk to your primary care provider, ask them to review your medication with you with a specific focus on any that could impair your balance. And then work with them to determine if there are alternatives that might be just as effective that don't put you at risk for falls. So you really have to weigh the pros and cons on a one-by-one individual basis. So then the vestibular system. If you're not familiar with the vestibular system, it's the inner ear. And that inner ear system sends messages to the brain about the position of the body and the head in relation to the ground. So people who have problems with their vestibular system, they might be, like they say, they're dizzy, or they might feel spinning, or even spatial disorientation, which means they don't know which end is up. And it's really, obviously, if you don't know which end is up, it's really high risk for falls. So if you do have these symptoms, there is treatment that most people respond very positively to, but you need to see a medical professional for that, one who specializes in vestibular issues. Now, in the meantime, hold on. Hold on to railings, hold on to another person who's stable, use your cane or your walker if you have one, and then turn your head slowly. And all of these strategies are especially important if you have a cold or the flu, even if you don't generally have vestibular problems, because of the way the inner ear is connected to the sinuses. If you have any trouble with your sinuses, it can impact your balance and your inner ear function. So hold on and make sure you use your cane or your walker if you have one or need one, and especially if you have the cold or flu. So then there's a few other medical conditions we want to talk about, because these are all mentioned for risk for falls. So number one, ensure that you get a periodic checkup by a specialist. Get a referral to OT or PT, occupational therapy or physical therapy, if your condition changes. Either usually it's a negative change that you go see them for, and they can either get you back on your feet or help maybe you adapt the way you're doing things, or maybe give you specific recommendations on how to modify your environment to manage your specific risks. The orthostatic hypotension one I want to bring your attention to, that's the one where your blood pressure decreases as you stand up quickly. And that one is specific for falling because you get just really dizzy really fast. So if you ever feel a little lightheaded when you stand up, or things go a little bit dark, talk to your doctor about it. But also, just wait, hang on. Don't step away from your chair. Keep the chair right behind you in case you need to sit down, or hang on to something until that clears up. Your blood pressure will recover. It'll go back to your brain, and you'll be able to then step forward. So it just takes a little modification to how you get up and get going. And then let's talk about pain. That's the final specific risk factor we're going to talk about today, especially pain in the joints, or it could be from a disease, or it could be from an old or a new injury, or the aches and pains that are often just associated with living a full life. So there are multiple options for pain management. And the key here is to just try them all until you find the one that is really the best fit for you, the one that manages your pain the best. Recommend you try some gentle exercise. Now, in the water, it's great. If you can get in the pool, warm water is best. Loosens up the joints as well as reduces some of the pressure on them. Tai Chi, movement-based therapy, is really good for balance and joints. Yoga is also known to decrease pain, increase flexibility. So not only do they manage pain, but they also improve balance in other ways. Now, a TENS unit may also help specifically with pain, and these are small electronic devices. You may have seen them advertised lately. You can buy them at most medical supply, or even over the counter at a drugstore. And they're devices that emit a little bit of electricity through the skin and can break the pain cycle. It feels like a little tingling, not painful at all. And then also medications. That is definitely a valid option to treat pain, but the problem is that many pain meds have side effects that increase the risk for falls. So it's kind of a danged if you do, danged if you don't one there. So before we wrap up, though, I want to talk about some general solutions that really apply to everybody. Let's consider the indoors first. So we've got loose floor coverings and rugs. Now, I know that, if you find them attractive, they're very, very beautiful, but the edges tend to grab the foot or grab the walker. They can grab a cane and just stop you dead in your tracks. Really throws you off balance. So if you really must have them, tack down the edges, either with a anti-grip thing or actually tack them down to the floor if possible to keep them from rolling up or snagging a device or your foot. Lighting, add lighting, especially LED lights. There's new improvements to those lights. They turn on right away. They're very bright. Use night lights, which I mentioned with the bladder, but just in general, if you got to get up at night, or a motion sensor light, and then reduce glare. A lot of shiny surfaces make it hard for eyes to accommodate. Clutter and cords, they will grab you. Think about oxygen cords as well as power cords. Keep the path clear, including, like I mentioned earlier, clothes on the floor, or anything that's blocking your path. And then insufficient support. So a lot of people will try to grab onto a towel bar or a toilet paper bar. Imagine if you did lose your balance, that's going to come right off. That's not meant to support your weight. So really having properly installed grab bars are key, and then ensuring handrails are secure at your own, or if you go to a friend or family's house, make sure that they're going to give you the support you need, because if you do fear falling, you want something to grab onto to improve your sense of steadiness. And also non-skid straps on steps can really, especially wooden steps, can help both define the edge of the step as well as give more additional traction. Then thinking about the outdoors, a lot of this has to do with planning your route in advance. Really take a moment, scope out the environment, look for hazards in your way, especially if you're traveling to somewhere unfamiliar. Look for curbs, watch for traffic, as you might take more time to cross the street. Wait. If the light has been green for a while, wait for the next green light so that you have the full amount of time to get across the street. Weather, thinking about rain, how it can increase slipperiness, or if there's ice, maybe you need to rearrange your schedule, go out a different day if it's going to be that bad, if it's going to put you at a risk for falling. And plan extra time, like we talked about earlier. Just don't make you hurry. Always it's better to be late than down on the ground. Also, most people love a really nice pair of shoes, but make sure they're both attractive and functional. Find them that you really like and like to wear with your outfits, because function tends to be more important than fashion when it comes to falling. And then, as I mentioned earlier, use sunglasses. That can really help improve contrast and allow you to see any hazards. So, taking control. That requires action. So the fear of falling is not misplaced. It is true. There's a high number of people who fall, and if you fear that you may fall, then that's a pretty good, accurate assessment of your status. But it doesn't mean that you're just going to be that way. So reducing your risk factors is in your control. So pick one area we learned about today and take action. Now, once you have that area under control and you've done something about it, then pick another one. Pick the next one that speaks to you the most, that seems the most impactful for your lifestyle, and then repeat that, continuing to take a look as you change throughout your life. The different factors may become more or less important. So small efforts can make a big impact. So act today. Thank you very much for listening. I sure appreciate your attention. I wish you a safe and happy rest of your day.